So what the heck is a prostate anyway? Is it located in your kneecap? No, not there. Is it a prostrate or a prostate? Well, today we'll be getting you completely up to speed with what you really need to know about this small gland, including but not limited to the function and what can possibly go wrong with the prostate. So stick around. The show today is brought to you by our sponsor, the Prostate Health Academy. More and more healthcare consumers are leveraging online resources to not only prepare for appointments, but also validate physician recommendations. With the Prostate Health Academy, you no longer have to spend hours upon hours on Google and YouTube doing your research. The Academy will save you time and quickly get you up to speed with comprehensive and easy to navigate lessons that I've prepared for you. We also have an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Again, that is www.prostatehealthacademy.com and click on Join Now. We'll see you on the inside. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. So again, we have taken a break from recording any new interviews until Season 3 is here at the Prostate Health Podcast. We've had a lot of excitement here recently with the launch of the Prostate Health Academy. In addition, please keep our family in your thoughts as we will be welcoming our third child to the family tomorrow morning. Yep, has definitely been a busy month. So for this week, we're going to circle back around and bring back the very first Prostate Health Podcast episode out of the vault, episode number 1. If you've not listened to the episode yet, please stay tuned. This was a very informative interview with urologist Dr. Brantley Thrasher, who tells you everything you need to know about what is a prostate anyway. This really does form the foundation for your understanding of the prostate and what can go wrong with this little gland. This will be very important to grasp, no matter what stage you are in your prostate journey. So here you go. Again, with us today is Dr. Brantley Thrasher. I have to admit, when I was initially developing the podcast and thinking of potential guests, you were one of the very first names that came to mind. With the podcast, I'm interviewing experts, innovators, and leaders in the field of urology, and you certainly checked all the boxes. Dr. Thrasher is immediate past president of the American Urologic Association, former chair of the Department of Urology at the University of Kansas Medical Center, and is current executive director of the American Board of Urology. In addition to giving more than 400 presentations at local, national, and international meetings, he has written more than 190 manuscripts, book chapters, and monographs in the field of urology, and I could go on and on. Dr. Thrasher, welcome again to the show.
Thank you so much, Garrett. It's an honor.
So from an educational standpoint, in my practice, I hear patients commonly mix up the words prostate and prostrate. Is this something that you've heard along the way as well?
Absolutely. I think people are a little confused of what is the prostate. Instead of lying prostrate, as you and I understand the word, prostate obviously is something different. It's an organ that we all deal with. And as men, as you age, it's going to become more and more of a problem for some people.
So the word prostrate isn't more of an adjective or verb, meaning to lay stretched out on the ground facing downward. So we don't have prostrate gland or prostrate cancer, just prostate. So just a quick clarification, but something we actually hear quite a bit. So Dr. Thrasher, what is a prostate then for our listeners?
Prostate is actually a reproductive organ, Garrett, and I get a lot of questions as to why do I have one in the first place? It actually is a supportive organ. So when you ejaculate or when a male ejaculates, puts out fluid that supports the sperm while they're searching for an egg. So that's the primary purpose of the prostate.
And for our listeners, where is the prostate located? And so, for example, what are some of the structures that surround it?
Yeah, I tell the males that if you're sitting down right now, you're really sitting on the prostate gland. That gland sits at the base of the bladder, sits in front of the rectum, And one of the reasons that we can actually access it with digital rectal exam through the rectum is it is right in front of the rectum, so accessible by the fingertip. And if you've ever fallen on a bike and on the bike middle bar, you're landing right on the prostate. So that's where it sits.
So as far as the size of the prostate, I've heard some say it's, the size of a, acorn or a lime. I mean, and that really depends on the age. I mean, what would you say is kind of the average size, or how big is a prostate again?
We usually say about 20 grams or 20 milliliters. That's about the size of a walnut.
So what are some of the function of the prostate? What does it do for a man?
Well, as I mentioned, some of the fluid that is supportive fluid when you ejaculate, if you were to see just sperm, it'd be 2 or 3 drops. Most of that is coming from 2 supportive glands on the backside of the prostate called seminal vesicles, and they actually put out some of the sugar that the sperm can live on while they're living in the area searching for an egg, and then the prostate gland is putting out some of the rest of that fluid, and in that fluid are many things. Some of it just helps the environment that the sperm can live in, and some of it is actually, for instance, PSA. PSA is in the ejaculate. If a male were to look at the ejaculate when he first ejaculated, and you look at it, it looks very thick and viscous, but over the course of about 45 minutes to an hour, it begins to liquefy. Well, that liquefaction allows the sperm within that fluid to get out, sort of to get out into the area and search for an egg. And PSA, which is a serine protease, an enzyme, it's breaking down the viscosity. So that PSA actually has a function to break down the viscosity and allow the sperm to actually swim out, sort of better coverage to find an egg.
Well, we're going to take a quick break, then we'll be right back. Healthcare consumers are increasingly leveraging online resources to not only prepare for appointments, but also validate physician recommendations. The problem is that many individuals have no idea where to start when doing their research and waste many hours sifting through the endless sea of information on the web, not to mention the widespread prevalence on the internet for commercial bias and misinformation. For example, on YouTube, it is reported that 87% of videos on BPH and 77% of videos on prostate cancer contain misinformation. More and more individuals are now turning to the Prostate Health Academy for help. You no longer have to spend hours upon hours doing your research. The Academy will save you time, energy, and quickly get you up to speed with comprehensive and easy to navigate lessons that I've prepared for you. We also have an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Again, that is www.prostatehealthacademy.com and click on Join Now. We'll see you on the inside. Now, is there anything else that we need to know about the prostate anatomy? I know it's made up into different zones. Could you kind of go into a little bit more detail about what are some of the different zones of the prostate?
Yeah, for the listeners, I think the easy way to think of it is that a prostate's a lot like an orange. So the outer peel is where what we call the peripheral zone of the prostate, where primary cancers of the prostate will occur. The inner fruit of the orange is actually the benign growth. You hear men talking about getting up many times at night, dribbling, post-void dribbling, or what we call double voiding, getting up several times to urinate. And that's all because the inside portions, the fruit of the orange is growing and starting to impinge on the urethra. So it's like an orange with a straw driven right through it. That straw is the urethra or the tube that you urinate out of. And so I tell them that peripheral zone is where most cancers occur, and then the transition zone, or the fruit of the orange, is where the benign growth occurs. For the most part, that's about a 0.5 gram to 1 gram a year from the age of 40 until you die. So you can have prostates that will grow upwards of 200 grams sometimes, so very, very large, about 10 times normal size. But for the most part, I would say think of it as the benign tissue as the fruit of the orange. The outer portion, peripheral portion, is where most of the cancers occur, and that's one of the reasons we can stick a finger in the rectum and actually feel cancers if they're in that peripheral zone or the peel of the orange.
So Dr. Thrasher, can you tell our listeners a bit about what stimulates a prostate's growth?
Yeah, actually it's funny. If you were to castrate a male before he went through puberty, he generally will not have enlargement of the prostate. The reason for that is that there's a central gland in the brain. It's called the hypothalamus. And it stimulates the anterior pituitary, real close to it in the central brain. And that stimulates the testicles to put out male hormone, testosterone. Testosterone is what causes the prostate to grow. So that benign growth is critically hinged to male hormone, testosterone.
So what can go wrong with the prostate, or what do men really need to worry about with the prostate?
Yeah, there's several maladies that occur, and we see them a lot. We'll see prostatitis in young men or older men. So you can get an infection or inflammation of the prostate. That's one. The second is what we've just talked about, enlargement. But enlargement to the extent that now you're having a change in quality of life. Getting up several times in the evening, can't get back to sleep. I'm a traveling salesman and I have to stop every rest stop or even carry a jug with me. Or you get to the point where you can't urinate at all. So that would be a benign enlargement that's impinging on the urethra, and it won't allow you to drain. So you're keeping too much in your bladder. And then finally, the third thing that we hear an awful lot about 1 out of every 7 men will suffer from clinically significant prostate cancer. When I say clinically significant, something caused us to find it. An elevated PSA, the blood level that I talked about, PSA, prostate-specific antigen, or a digital rectal examination where you feel something hard. And I tell the patients, if you feel where your thumb meets your palm, that's what a prostate should feel like, or the tip of your nose. Now, your knuckle is something abnormal. That's a hard nodule. That's what the doctor's feeling for, is something firm like that that could signify cancer in lieu of being just benign, pliable tissue like the tip of your nose.
So if it's, we talked about some of the functions of the prostate, but essentially not a vital organ to survive on, given its potential for it to cause problems. I get a lot of patients that ask me, so why can't I just remove the prostate altogether and just be done with it? What are some of the potential consequences in doing that?
It's interesting. I get the same question, Garrett, all the time. I'll have men that come in and say, I've had so many infections in this prostate. Why can't I just take it out? It's driving me crazy. And I don't want kids anymore. So if it's a reproductive organ, why worry about it? And then the second thing, you get a cancer, or maybe just short of that. You've had an elevated PSA, multiple biopsies. The man's just getting sick of having the biopsies and feeling as though he's got a cancer there. We just haven't been able to find it. Why not just take it out? Well, the prostate, the good Lord gave you a prostate for a variety of reasons, but it does some good things for you also. One of them is when you ejaculate as a male, prostate helps close the bladder neck so that the path of least resistance is for that ejaculate to come out instead of going back into your bladder. That's called retrograde ejaculation. So that's one thing. The second thing obvious is that it also helps you with your continence. The internal sphincteric mechanism, the muscles that actually surround the base of the bladder, are actually within the prostate. So it helps you when you cough or sneeze or you get up out of a seated position. It'll help you from leaking urine. So incontinence is the second thing that helps prevent. And then the third thing is the nerves that allow a man to have an erection. I'm not talking about sensory nerves, which mean the feeling of the penis, for instance. They don't affect that. They don't affect the overall, what we would sort of call ejaculation function. So those are sympathetic nerves that allow you to orgasm, but they do affect the ability to have an erection. And if you feel in the penis, you've got 2 cylinders that fill with blood when you're excited. And the message that comes to those 2 cylinders are coming from nerves that are on the underside of the prostate, the underside of the orange. You take out the orange, there's a good chance you could hurt those nerves that give you the ability to have a natural erection. So that's 3 good reasons to be very careful, just to say, take it out. It's bothering me. Maybe I've got a cancer and don't want to worry about it anymore. There are some downstream consequences.
Well, Dr. Thrasher, this has been a great kind of introduction for our listeners in terms of, some of the prostate anatomy. Any other kind of thoughts in terms of the prostate? Or I think we did a pretty good job of covering it there.
Patients ask a lot, and you alluded to this when we first started. I think anyone could check a prostate, but I think if men believe they're having a particular problem, we mentioned some of the symptoms, getting up multiple times, having some discomfort when you sit down, you have a family history of prostate cancer, African-American race, for instance, you need to see a urologist. Now, I'm not trying in any way to be disparaging about our colleagues in internal medicine or family medicine, but what I will tell you is the urologists have the most experience with this, and I would seek a good urologist in a case like that. Board-certified urologist would be my recommendation to then check it out, because I think you really need to see an expert in cases where you're having symptoms.
Yeah. So in summary, the prostate, not prostrate gland, is a small gland which can actually cause a bit of trouble for men. Well, if you want to continue the conversation with Dr. Thrasher and I, please join us on the inside of the Prostate Health Academy, where he will be imparting his wisdom for those individuals with a new diagnosis of prostate cancer, including his tips that you need to know as you're navigating treatment options. Dr. Thrasher, I think you've really given our listeners a lot of value today and really an essential introduction to the prostate as we start to dive even deeper into prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions. We appreciate you taking time out of your very busy schedule to join us today on the Prostate Health Podcast. Thank you again. I want to thank you again for joining me here at the Prostate Health Podcast. Subscribe to the show on iTunes, Google Play, Spotify, or wherever you listen to podcasts. And please share it with a friend who may find this podcast helpful. We'll see you at the next episode.